Magnesium glycinate is known for helping with sleep, stress, and muscle cramps, and you've probably heard a lot of good things about it. But here's what fewer people talk about. For some people, this so-called gentle supplement quietly causes problems. If you're taking it daily, or thinking about starting, there are a few situations where this popular supplement isn't so gentle after all. Today we're going over the key mistakes that mean you should pause, pay attention, and talk to a healthcare professional before continuing. This isn't about scaring you away from magnesium. It's about making sure you're using it safely and effectively. Let's dive in. First, let's quickly cover what magnesium glycinate actually is so we're all on the same page. Magnesium is an essential mineral that your body needs for hundreds of different processes. It's involved in muscle function, nerve signaling, keeping your heart rhythm steady, supporting bone health, and so much more. You can't live without adequate magnesium. Now, magnesium comes in many different forms, and glycinate is one of the most popular. In this form, magnesium is chemically bound to an amino acid called glycine. This combination is often easier on the stomach compared to other forms of magnesium like magnesium oxide or citrate, which can cause digestive upset or act as laxatives. That's why magnesium glycinate has become the go-to choice for people looking for sleep support, anxiety relief, or help with muscle tension and cramps. It's marketed as gentle, calming, and well-tolerated. And for many people, under the right circumstances, it genuinely can be helpful. But here's the important tone I want to set right from the start. Helpful for many does not mean risk-free for everyone. Just because something is natural or sold over the counter doesn't mean it can't cause harm when used incorrectly or by the wrong person. So let's talk about the mistakes people make. Mistake number 1 is probably the most common one I see. Taking too much magnesium. There's this persistent belief that if a little bit of a supplement is good, then more must be better. That's simply not how your body works, especially with minerals like magnesium. When you take too much magnesium, your body tries to get rid of the excess, and that process isn't pleasant. High doses of magnesium commonly cause diarrhea, nausea, stomach cramping, and general digestive discomfort. Your intestines pull water into your bowel to dilute and flush out the extra magnesium, which is why loose stools are often the first sign you've overdone it. But the problems don't stop there. Taking excessive amounts of magnesium over time can lead to more serious issues like dangerously low blood pressure, irregular heartbeat, and in severe cases, magnesium toxicity, which affects your heart and nervous system. Now, how much is too much? Most magnesium glycinate supplements contain somewhere between 200 and 400 milligrams per serving. The problem is that many people don't realize they're getting magnesium from multiple sources. Maybe you're taking a magnesium supplement, but you're also taking a multivitamin that contains magnesium, a calcium-magnesium combo pill, or a sleep formula that includes it. Before you know it, you're stacking doses without even realizing it. Your body doesn't care whether the magnesium came from 1 bottle or 3. It only knows it's getting more than it can comfortably handle. Here's the key line I want you to remember. If your stomach is constantly upset after starting magnesium, your body is waving a red flag at you. It's not asking for a higher dose. It's telling you to back off. Mistake number 2 is a critical safety point that could literally save someone's life. Taking magnesium glycinate when you have kidney problems. Your kidneys are responsible for filtering your blood and removing excess minerals, including magnesium. When your kidneys are healthy and working properly, they do a great job of getting rid of any magnesium your body doesn't need. But if your kidney function is reduced, either from chronic kidney disease, kidney damage, or just age-related decline, those kidneys can't remove excess magnesium efficiently. When that happens, magnesium starts to build up in your bloodstream, and elevated magnesium levels in your blood can become genuinely dangerous. The symptoms of too much magnesium in your system include extreme fatigue that doesn't improve with rest, muscle weakness that makes normal activities difficult, mental confusion or difficulty thinking clearly, and a dangerously slow heartbeat. In severe cases, magnesium toxicity can lead to cardiac arrest. This is not something to take lightly. Anyone who has been diagnosed with any stage of kidney disease, anyone on dialysis, or anyone who's been told by their doctor that their kidney function isn't optimal should never start taking magnesium supplements without direct medical supervision. Even if you think your kidneys are fine, if you're over 65 or have diabetes or high blood pressure, conditions that commonly affect kidney function, you should get your kidney function checked before adding magnesium supplements to your routine. This is one area where you absolutely cannot afford to guess or self-diagnose. Mistake number 3 involves ignoring the connection between magnesium and blood pressure. Magnesium has a natural effect of relaxing blood vessels, which is actually one reason it can be helpful for some people with high blood pressure. But here's where it becomes a problem. If you already have naturally low blood pressure, if you frequently feel dizzy when you stand up, or if you've had fainting episodes, adding magnesium to your daily routine may make these issues significantly worse. Your blood pressure might drop too far, leaving you feeling weak, unsteady, and at risk of falling. Warning signs that magnesium is lowering your blood pressure too much include feeling lightheaded or dizzy, especially when you stand up from sitting or lying down, experiencing blurry vision when you change positions, having more frequent near-fainting spells than you did before starting the supplement, or feeling unusually weak and tired even though you're getting enough sleep. If any of these symptoms show up or get worse after you start taking magnesium glycinate, this isn't your body adjusting to the supplement. This isn't a phase you need to push through. It may very well be your blood pressure dropping too far below a safe range. In older adults especially, low blood pressure can be just as dangerous as high blood pressure because it increases fall risk, and falls can lead to serious injuries like broken hips or head trauma that change your entire quality of life. Mistake number 4 is huge and gets missed all the time. Mixing magnesium with certain medications without understanding the interactions. Magnesium doesn't exist in isolation inside your body. It interacts with other substances, including prescription medications, and these interactions can either make your medications less effective or cause dangerous side effects. Let's go through some of the most important medication interactions you need to know about. First, if you take blood pressure medications, adding magnesium can cause your blood pressure to drop too low. This is especially true with medications like ACE inhibitors, calcium channel blockers, or beta blockers. The combination of your medication plus magnesium both working to lower blood pressure can push it into dangerous territory. Second, if you take diuretics, commonly called water pills, these medications already affect your body's mineral and electrolyte balance. Adding magnesium to the mix makes that balance even trickier and can lead to unpredictable levels of magnesium, potassium, and other electrolytes in your blood. Third, certain antibiotics, particularly tetracyclines and fluoroquinolones, can have their absorption blocked by magnesium. If you take your antibiotic and your magnesium supplement at the same time, your body may not absorb enough of the antibiotic for it to work properly, meaning your infection might not clear up. Fourth, medications for osteoporosis like bisphosphonates and thyroid medications like levothyroxine can also have reduced effectiveness when taken with magnesium. Here's the practical tip that can solve many of these problems. Magnesium should often be taken at a completely different time of day than certain prescriptions. For example, you might take your thyroid medication first thing in the morning on an empty stomach, and then wait several hours before taking magnesium. The same goes for certain antibiotics and bone medications. But here's the thing. You shouldn't have to figure out all these timing issues on your own. If you take any prescription medications regularly, you need to tell your doctor or pharmacist that you're considering taking or already taking magnesium glycinate. They can review your complete medication list and tell you if there are any interactions you need to worry about and how to time things properly. Mistake number 5 is using magnesium to self-treat serious symptoms. And this is an important reality check we all need. I completely understand why people turn to supplements. Medical care can be expensive, getting appointments can take time, and there's something empowering about taking your health into your own hands. But there's a line between supporting your health with supplements and ignoring warning signs that need professional medical evaluation. People sometimes start taking magnesium because they're experiencing chest tightness, severe muscle weakness, heart palpitations, or numbness and tingling in their hands or feet. These symptoms can indeed sometimes be related to magnesium deficiency, but they can also be signs of much more serious problems like heart rhythm disorders, nerve damage, significant electrolyte imbalances, or even heart attacks or strokes in progress. Taking a magnesium supplement and hoping these symptoms go away is not an appropriate response. Here's the message I need you to hear clearly. Magnesium is not a substitute for proper medical evaluation when symptoms are new, severe, or getting progressively worse. If you're having chest pain or tightness, unexplained shortness of breath, severe unexplained muscle weakness, heart palpitations that won't stop, or neurological symptoms like numbness, tingling, or vision changes, you need to see a doctor, not reach for a supplement bottle. Get the diagnosis first, then decide on treatment. Maybe magnesium will be part of that treatment plan, but maybe you need something entirely different, and the only way to know is through proper medical evaluation. Mistake number 6 involves taking magnesium despite ongoing digestive distress. Even though magnesium glycinate is considered one of the gentler forms of magnesium for your digestive system, it can still cause issues in some people, particularly those with sensitive digestive systems to begin with. If you have chronic diarrhea, irritable bowel syndrome, inflammatory bowel disease, or just generally sensitive digestion, magnesium supplements can worsen your symptoms significantly. Some people notice that their IBS flare-ups have become more frequent or more severe since starting magnesium. Others develop chronic loose stools that they just accept as their new normal without connecting it to the supplement they started taking around the same time. Here's the problem with ongoing digestive distress. Chronic diarrhea isn't just uncomfortable. It can lead to dehydration, electrolyte imbalances, malabsorption of nutrients from your food, and a whole cascade of other health problems. If your gut has been in chaos since you started taking magnesium glycinate, there's a very real possibility that your supplement is part of the story. Your body is telling you something important. Listen to it. You shouldn't have to live with constant digestive upset just to take a supplement. There are other ways to support your magnesium levels, including eating magnesium-rich foods like leafy greens, nuts, seeds, and whole grains, or trying a different form of magnesium that your particular digestive system tolerates better, or working with a healthcare provider to figure out if you even actually need supplemental magnesium in the first place. Now, I want to balance this message because I don't want you to walk away thinking magnesium glycinate is dangerous for everyone. It's not. For many people, when used appropriately and under proper guidance, magnesium glycinate can genuinely help with issues like mild muscle cramps and muscle tension, supporting better sleep quality for people who have trouble falling asleep or staying asleep, and helping manage the physical tension that comes with stress and anxiety. The key words in that sentence are appropriately, guidance, and mild. This means the right dose for your specific body and needs, the right person without contraindications like kidney disease or problematic medication interactions, and the right timing in terms of when you take it during the day and in relation to meals and other supplements or medications. Magnesium can be a helpful tool in your overall health toolkit, but it needs to be used thoughtfully and carefully, not carelessly. Let me give you a clear, calm wrap-up of everything we've covered today. Magnesium glycinate can absolutely be helpful for certain people in certain situations, but you should stop taking it and seek medical advice if you notice persistent dizziness or lightheadedness, severe or unusual fatigue that doesn't improve, ongoing stomach distress including diarrhea, nausea, or cramping, any new or worsening heart palpitations or irregular heartbeat, or if you have kidney issues of any kind, or if you take medications that affect blood pressure, heart rhythm, or mineral balance. Even if none of these red flags apply to you right now, it's still smart to talk with your doctor or pharmacist before starting any new supplement, especially if you have existing health conditions or take prescription medications. They know your complete health picture and can give you personalized advice that random internet articles or supplement bottle labels simply cannot provide. Here's the final reassurance I want to leave you with. Supplements should support your health and make you feel better, not quietly complicate your life or create new problems. If something you're taking is making you feel worse, you have every right to stop and reassess. Your health and safety matter more than finishing a bottle of supplements you already bought. If you found this information valuable and it helped you understand magnesium safety better, please give this video a like and subscribe to our channel for more honest, balanced health information that empowers you without the fear-mongering or hype. Share this video with friends or family members who take magnesium supplements or who are thinking about starting them.